another IC which we presented 3 days ago, and I hope the audience is different here. Um, so, Operation Theatre etiquette is something that we should follow in order to prevent endophthalmitis. And we know about the cluster endophthalmitis, the cause of which is the CSST factors and the fluids, etc. The intraocular fluids that we use, versus the solitary endophthalmitis that we get because of patient factors, which the previous speakers have alluded to, the surgical factors, and the most important, which I will be presenting now, is the breach of protocol. So the common mistakes in OT protocol, let us see what it means. And this presentation also probably explains that solitary case of endophthalmitis from a list of 5 to 10 cases on a given day. So these are all the patient factors which have already been covered. I don't want to repeat. Hygiene of our poor patients, superstitious beliefs of our rural patients. Yeah, coming to the point, here we have our resident who is fresh and has been asked to scrub and come in and assist. So he comes in, scrubs as per instructions, and he is asking for a stone towel, and he is actually violating the airspace of the trolley. So a drop of fluid is actually dripping onto the trolley, which is just plain water from the overhead tank, which has contaminated the trolley. So he has actually done damage by just scrubbing and not giving respect to the airspace of the trolley, which is a big mistake, I would say. So this is another instance which, see, these are all instances which I have noted and I have recorded, and recorded them on the mobile phone, and I want to share with you all that these are these small instances where the solitary case of endophthalmitis can be explained in spite of clean surgery, in spite of a clean patient. So this is, if you suddenly ask the patients, the attendant or the OT boy to get a pair of gloves for you, he will rush and come, and he will be not, heading to the trolley space, the space around the trolley. He would have touched the trolley tip, which will be eventually handled by the nurse, and in the process cause contamination to the entire contents of the trolley. Whereas the actual correct way of movement in the OT is to keep away from the trolley, give respect to the trolley, and uh, that is the way to go. So beware of surroundings while wearing a gown. Gowning is something that is extremely important. You should have sufficient space around you. See, this is just to show. This is actually me showing how the strings of the handcuff have been touching the equipment on the sides, in the process getting contaminated, and you are touching that with your bare hand, which is of course washed but not sterile, and in the process getting contaminated. So these are some of the examples where this is an example of how to wear the gown correctly. Have space around you, and don't ever touch anything around don't ever let the gown touch anywhere around the space where you are occupying to stand and change. So this is, so a short term trainees, they come very frequently to our hospital. They have not been actually taught how to wear gloves, and I got this boy glove in hand. He had come for a short term cataract training, and this is how he was wearing gloves. So, if you are not vigilant, if you are not watching how he has done it, how he has worn the glove, then his glove is totally contaminated, and he would have contaminated the entire operation theater environment just by not wearing the glove properly. So, the ideal way of gloving I would like to show here. Of course, we don't have students, I think, in this auditorium, in this hall, but sorry, so this is the way. You should not even touch the glove with the bare hand. You can see that I'm holding it with the cloth, with the linen. Not to touch the sterile outer surface of the glove is extremely important, and to touch only the inner side, which is in contact with the skin, is what you should follow. Gown removal is another thing which helps us in reducing the scrubbing time between surgeries. Supposing you want to change your gown between, say, after 3 or 4 surgeries, that is the guideline of the AIOS as well. You can wear your gown for 5 surgeries, but wear different gloves for every surgery. So this is how the gown has to be removed, because the inner surface of the gown, which is in contact with the skin, is still sterile, and the way you remove it inside out is extremely important and helpful in in reducing the scrubbing time, which can be reduced even half. Just about 2 to 3 minutes of scrubbing is enough if you have removed the gown that way. Peeling of sterile pouches, I think I need not show this. This is common. But an assistant, a sister who is wearing a loose glove can do a mistake like this. This both are doing mistakes here. The man opening the the pouch with a pen in hand, and the sister wearing a loose glove, both can cause damage which can be disastrous. In slow motion, you can see that actually the loose glove is touching the pen, and she has now contaminated the entire OT trolley. So this is something that can happen. These are all things which actually happen. These are not imaginary. They happen, and they have been caught red-handed and told not to do it that way. They have been trained for that, to overcome those um, the wrongdoings. So this is another uh, example of violation of airspace of the trolley. The lady there wants to see the file because the surgeon will ask what are the details of the patient, but in the process, the pen has been dropped on the trolley, and if they are not honest, see, in the absence of the doctor, they may just pick up the pen and go away and pretend as though nothing has happened. But if they are not honest, you had it. The patient will develop endophthalmitis. So this is another example of how a solitary case of endophthalmitis can happen. Shaking the bottle is very, very important to look for impurities. I think we all know this. This is something that is extremely common and important to know. You have to see that the IV set is properly pierced into the BSS bottle, into the place where it is actually supposed to be pierced. If in the process, if some of these boys drink and come, they drink at night, they're, you know, some of them can be very indisciplined, they have tremors. In the process, if they touch everywhere else except at the cock, and then pierce after touching everywhere else, then the entire basis bottle can get contaminated. So this is something we have to keep a watch for, keep training them, inculcate a sense of discipline in all these staff members. Similarly, an ampule that has been cut irregularly, wrongly cut, with a lot of glass pieces having gone in, causing contamination of the contents of the ampule, and the syringe, the way the needle has to go in cleanly into the bore of the ampule is extremely important, because otherwise, if the needle touches if the needle touches the outer part of the ampule and then is passed inside, it is contaminating. The entire contents of the ampule are contaminated, and therefore this can cause endophthalmitis. Painting and draping are, needless to say, very, very important. The novice resident has to know. These are all presentations which were meant for the resident, but I thought it was appropriate to tell all this again in an endophthalmitis session. So this is the actual correct draping procedure, with all the lashes outside turned out, so that none of the lashes will, actually come into the field of surgery. And one thing is that we some of these busy surgeons will call from home to paint and drape the patient, especially if they are staying nearby. And this actually happens in institutes. The sister is waiting with the trolley ready. The patient is draped. The surgeon has not even come in, but the surgeon is, not yet come. The resident is waiting. He's probably feeling hungry. He's just waiting patiently, and look at what happens to the trolley. The nurses have gone out because They're fed up of waiting. And this patient who is being readied for a pterygium surgery, not blocked, not yet given, he is looking at his watch because he's impatient and wants to know how far he has been, how long he has been on the table. So this is something which has actually happened, and we would definitely want that it should not happen again. So this is another example of the surgeon suddenly coming in and the nurse is getting suddenly alert, and look at that. She's just squeezed in between the head of the patient and the trolley, the back touching the head end of the patient, which is extremely wrong. Anything below the waist is unsterile. Not even the gown is sterile, actually speaking. It's only the glove area, the wrist, up to the wrist is all that is sterile. Even the gown is not fully sterile. It is, yes, sterile, but not like the gloves. So this is again a source of contamination. Use of cannulas which are blocked should not be done, because if the cannula is blocked, it is not sterile. An unclean or a blocked cannula cannot be sterilized. If among all the processes that happen during a CSSD process, like cleaning, rinsing, drying, monitoring the set of instruments, disinfecting, and packing. The most important is probably cleaning, and if you cannot clean it, you cannot sterilize it. Please remember this. And never try to clean after sterilization. So this is something which I would like skip. The anesthetist is usually a visiting anesthetist. Many of us don't have in-house anesthetists, and they're always on their WhatsApp. They induce the patient. They're always on the WhatsApp. Any message that you have to convey to them, they're so engrossed in their WhatsApp. You have to send a WhatsApp message to say that you need something, or to say the patient is getting blue or the patient is bleeding because of hypertension. And they don't wear masks. I'm sorry if there's any anesthetist here. I'm sorry to offend, but this is a fact. We have to enforce our rules on the visiting consultants as well. Borrowing instruments from the adjacent set is something wrong. And in a camp setting, there is poor personal hygiene, like I already said. There's overloading of the autoclave bins. There's high-speed surgery going on, and there is reuse of instruments, and there is this MDCS, which I just mentioned, minimal duration cataract surgery, which I hate. It is, you have to do surgery at a safe speed, and not something like this in what happens in a bakery. So this is done so rapidly, definitely not appropriate for a hospital setting, for kind of work that we do in a hospital. They're all highly skilled, there's no doubt about that. They're all highly skilled, but then definitely not appropriate for eye surgery. So no MDCS, please. No minimal duration cataract surgery. So as much discipline as a pilot landing a plane is what we should exercise. I'll just show this landing because it's so fast, and the safety margin is so less in a landing of a plane. We all travel by flight, and we know how much the skill is required on the part of the pilot to land a plane. So this is the kind of discipline that we have to maintain in the operation theater as well. So in summary, checklist is very important. You have to refer to all the listed things in the checklist, and it's like the cockpit. Everything has to be checked. The overall cleanliness has to be maintained. Standard protocols, like I showed, are to be maintained. This is just half of the presentation which I usually do in other situations. I have another 20-25 videos which show the common mistakes which we normally do in our operation theater. Training of staff about etiquette is very important. An ounce of prevention is equal to a pound of cure is the message that I want to give today. Thank you very much.